Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today's topic or question is design consideration for Pediatric Dental Clinic. Mainly ask question in short note for both undergrads and masters. First, you have to make an index including headings and subheadings followed by references, must for the students doing masters. Children behave, expect and relate to the surroundings much differently. So the clinic should be child friendly. To make the clinic child friendly, there are some important aspects to keep in mind, and we can remember it step by step. For example, first imagine one clinic setup starting with the empty space, front desk, waiting area, etc. So remember each area or point importance of the same and write it down. So the starting with the space provision or the play area. Children require empty space because they don't sit free. So provide space to the children is important. Put a fish tank or a slide in a vacant area. Engage them in some interesting activities to relieve their anxiety before checkup. If your clinic has a great deal of space, then put a number of small tables for children so they can draw and play together. Coming to the front desk. When we talk about the front desk, the receptionist should be in the focus. They have a communication skill to deal with the child effectively by calling them with their names and converse about the topic of interest. Also join them in a play area, watch their behavior so that can help the dentist during the child's visits. Basically, the receptionist should be able to keep the child engaged. Coming to the waiting area. This is for big children and parents. This can comprise books, games, magazines to keep engaged the children as well as the parents that can help to feel refreshing and relieve anxiety. And it is better to have a separate bathrooms for children and adults in the corner of the hall. Coming to the attire and presentation of clinical staff. So coming to the main clinic, so the first is attire and presentation. If possible, don't wear typical white coat until the child get friendly because it might increase the anxiety of the child. Meet in a consulting room and not around the dental chair. Take a brief history, assess the behavior, showing around the clinic, meeting other staffs and direct towards the dental chair. Coming to the color, smell and sound. Bold, bright, fresh color such as the yellow, red, blue, green, orange and pink because they dislike the grey, black and white color. Use a mild air freshener because they don't like smell of spirit, eugenol, acrylic and waxes. They don't like noise of aerator, handpiece and suction and compressor. So mask these sounds by use the light instrumental music. Coming to the instruction for the child and parents. So there should be an instruction boards or notice boards in the consultation room with the instruction for before dental visits and some post-treatment instruction. There should be a booklet or brochure as a pre-treatment communication should give them soon they enter to the clinic. Coming to the readiness to accept the children. So dentist and the staff should be always ready to accept the child the way he or she is. Use the behavior modification techniques only after the communication and observation, and that also if needed. In initial visits, dentist and dental team should focus on communication with the child to gain their confidence. And child do cry, but it's normal. Coming to the gifts and rewards. There are many type of the reward that dentist can give. We'll talk about that in a later topics. For now, give a child a token of appreciation, a verbal appreciation, and never bribe the child before the treatment. Coming to the audio visual aids for entertainment. So dentist can put a TV in front of dental chair for the distraction of the child, and they can put also camera attached to a TV set displaying the child on the chair because the child love watching themselves. Coming to the team approach, always work with a plan for each visit. Dentist should make an appointment of cooperative child first to make them model for another child. Always plan a procedure requiring the minimal cooperation initially and the complicated ones later. Coming to the design of equipment. You should know how some equipment should be in general. So there should be an accessible sterilization area and the equipment. Sufficient number of instruments should be there. Storage in every possible spot. Hard surface floor under the operatory chair. Foot controller for operatory sink. Stress container should be out of the sight and out of reach from the children. A colorful towel to cover the restrained child. A camera to take first examination photograph. So there is some additional consideration you should mention and also keep in mind that there should be a horseshoe traffic pattern, plenty checkout space, glass as a sound barrier, arcade style video game should be there, many varieties of stuffed animal, hand puppets and other toys for distraction and a pleasure. Cleanliness and neatness are important. There are some references of the answers you have to mention must if you are doing masters. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics every day or alternative day on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.